Welcome to AFD TV. I'm Dr. Steve Samudrala here with Kim Linderman, our clinical allergy specialist at America's Family Doctors. Welcome, Kim.
Hi.
Thanks. So today we're going to talk about treatment options for allergies. So what are some of the options out there?
Well, there's obviously over-the-counter medicine, which usually is what brings you guys in to see us because it's not working. So my most preferred treatment option is going to be the allergy shots.
Sure. And yeah, as far as treatment options for the over-the-counters like Zyrtec and so on, really they're more just cover-up symptoms, right?
Yeah, they're just masking your symptoms just temporarily, and then as soon as that medicine wears off, you need to take another one and another one, and sometimes it never really helps.
Yeah, that makes sense. Yeah, and sometimes we hear on the advertisements or so on about sublingual therapy as as another option for shots. And so, what's your experience with sublinguals?
Sublinguals, I know that they treat just one allergen versus the 48 with the shots. So there's quite a difference there. What do you know about it, Dr. Sam?
Yeah, no, that's a good point. I mean, we've had some experience with it. I mean, for the sublinguals now that they have one from Merck, it's called Grastec, and another one's called Ragwitec. And the Grastec just does grass only, and the Ragwitec just does ragweed only, which is good, but most patients have more than one allergy.
Yeah.
Right? I mean,
most patients are polysensitized, meaning they have multiple allergens. So unfortunately, from the sublingual aspect, we can't treat you for your pet allergy, for your mold allergy, for all these different tree allergies. So that's why it's best to do the subcutaneous allergy shot.
yeah. I mean, it is an option that if somebody's really, for example, just terrified of shots. However, ultimately, hopefully, they'll see how small the needle is.
Yeah.
You know, And if for whatever reason, like your husband, you do it for him, right?
Yes.
Yeah. That if they're not comfortable doing the shot, most are. I mean, I'm comfortable doing it myself. My wife and my daughter is, but you can always teach a family member to do the shots.
How to do them? Yeah. It's called an allergy shot partner. So if you come in and you're terrified of needles, you can have a friend come in, a neighbor, a relative, a spouse. And we'll be glad to train them, too, on how to do your injections. And then over time, you may think that, hey, I can do this, and become comfortable doing your own shots at that time, too.
Yeah, exactly. So, yeah, my younger daughter will give me my shots sometimes, which is good. She likes to do them. But but sometimes I'll just do them myself because it's just quicker and easier. I can do both my shots in under a minute from start to finish. In fact, remember
great.
we did
It's
a video
very
and we
fast.
timed it.
Yeah, we did. It doesn't take much time at all.
Yeah, that's true. And then the sublinguals, as far as the ones that are prescription, there have been some coupons. We had some experiences where we gave the patient a coupon, and it was how much?
It's pretty expensive, so that's another big difference with the sublingual. It's like $600 a month per tablet. So if you had a ragweed allergy plus a timothy grass allergy, you could be paying $1,200 a month.
That was his insurance, yeah.
Yeah, with the insurance.
But by doing sublinguals, for him was only $300 for the year. Right,
Oh, okay.
or for doing for doing shots, right?
Yeah, I gotcha.
Shots ended up being
the shots
more affordable for him.
Were covered by the insurance, and it only ended up being $300 and something for the entire 12 months, and that's actually for 20 different allergens that patient had. So quite the difference in there.
Yeah.
Cost and all of that included. So.
And the shots are the gold standard.
Yeah.
Yeah. So really, there's not that many treatment options. I mean, there are some of those allergists out there who advertise sublinguals, but those are not covered by insurance.
Right. They're not covered.
So those would be actually far more expensive. And so yeah, I mean, so it's. I mean, it would be nice if someday there was another more options, but. The good news, the best option I found personally for me and my family has been the shots at home, just from the convenience of it. So,
They are good.
Okay, well, thank you. That was very helpful.
Yeah.
So, thank you for watching AFD TV.
Thank you.
See you next time.
AFD TV is designed to provide an educational discussion about current medical topics. For a personalized medical opinion, please consult your primary care physician or visit one of America's Family Doctors clinics today.